Very good evening, friends. Today we're going to start one more new remedy from the third year syllabus from the C series, and that is Caladium. I will share one interesting case. It was a case nearly about 10 years back with the young fellow around 35 years, male person, who came to me in a very bad, depressed mood. And then he was looking there, who is there with me, and no one was there, and then he was comfortable. Then he said, I want to tell my problem. I'm suffering from certain disorder and I have taken a lot of treatment, but it has not worked. And I'm in a bad mood. So someone told me that you must consult Dr. Rasal for your problems, and I am here. And then I asked, what's your problem? Doctor, I will not hide anything. I will tell you some very important thing, but this is not known to anyone. But as I want your treatment, I will tell you everything. 1 year back, I had extramarital relationship and I suffered from that disorder. I could not recollect that is what is. I was having yellowish pus from my urethra and it was there and it was too much troublesome. It was so painful. Something like gonorrhea or something, some name doctor have mentioned. And then I took the treatment for that. They have given me treatment for a month and I recovered. But thereafter, my main problem started. I never have a good physical relationship with my wife. I have developed an impotency. What has happened? I used to get an erection whenever I am in sleep. In a half sleep, I know that I am having an eruption. But as soon as I wake up, it totally ceases. I have tried. I'm trying to maintain or to make a relation with wife, but it is not complete. Whenever I try it, there is a immediate ejaculation, immediate, and the whole penis becomes flaccid thereafter. It is too painful thereafter. Whenever I used to make the contact, it is too painful. I have a pain at the tip and it's too painful. There is a lot of itching over the penis in the forepart. There is tremendous itching. And this has definitely started only after that 1 years back, this problem. I could not share that with my wife or anyone else. But today we had a big fight, and my wife said, if you are not able to satisfy me, I will leave you. So this has created a big problem for me. I become so irritated, but what I can do? And then I asked all details. Then he said that, doctor, there is one more habit which I had thereafter, that I used to masturbate a lot. And there, after masturbation, maybe this problem have aroused, or whether it is from gonorrhea, I could not know. But I'm suffering a lot. And I could not tolerate the noise which is there with your chair, it is happening. This chair, it is very much producing noise. I could not tolerate such type of noise. I want peace only. And this was the case, nothing more than that. Asked regarding the addictions, and he said that yes, I'm tobacco chewer, and since long time, since childhood, I'm using the tobacco, and it requires at least 10 to 12 times per day. So this was a difficult case. If tobacco chewer is there, your remedy never acts so fast. So that is also one part which we have to take into consideration. But what remedy? Looking like little bit nuck state, maybe something like selenium, but selenium, it is not, there is nothing, any history of any other disorders before that. So what to do? So basic thing, whenever such problem arises, it is better to open the repertory. Asked him to sit for some time, I will solve your case and then I will start give you medicine. So he agreed and he sat over there. I opened the repertory. I got few important rubrics. There is a one important rubric was there: erection incomplete, ejaculation of the semen during, soon to, immediately after, soon to. And only one remedy, caladium, was mentioned for 1 marks, single remedy. Then I searched whole male genital system, specifically the impotency and rubrics related with impotency. There was one characteristic rubric which the same story patient has told, that erection during half of sleep and cease when he gets awake. Single remedy, again caladium was mentioned. Third important rubric was that flaccidity of penis, masturbation from. Again caladium was mentioned for 3 marks. And I was knowing that caladium is the remedy where they are chronic tobacco smokers or tobacco chewers. This I was knowing. Then I was searching for all other things and I got many rubrics where the caladium was mentioned. Then there was one more rubric I got, that erections incomplete, gonorrhea after. Again a single remedy for 3 marks, caladium was there. Then pruritus of glans penis, it is there. Pruritus of prepuce is there. That is the characteristic of the caladiums which are present. Then I was searching for sensitive to the noise. And sensitivity to noise, yes, it is a very important symptom which is mentioned over there in Materia Medica. They are very sensitive to noise. They cannot tolerate the slightest noise. It is like a Theridion or like Asaram, like Bovista. This is one more remedy where, or Borax, it is one more remedy. So I was searching for the rubric and there was not sensitivity to noise which is specific for caladium, but fear noise from newspaper of, rattling newspaper of, single remedy of caladium mentioned over there. So it was a pure case of caladium. What to do? Miasm is very characteristically psychotic. The remedy is very defecting remedy. If you open the Borix Materia Medica, you will find that this remedy has a 30 to 40 days action. A remedy which acts in depth. And the whole case was revolving around caladium. So better to start with caladium. I started with caladium 30 in repeated doses for 10 days. And asked him to meet me after 10 days. After starting the caladium, first important thing which happened, that there he has developed an aversion to tobacco. That was interesting. Doctor, I could not understand that. I stopped my tobacco. After 3, 4 days, I stopped my, how it was not possible, but it automatically this has happened. You told me that you don't take it, but I tried my level best and after 3 days it left. And now there is no need, or there is no even, I could not recollect that I have to take the tobacco. Second important thing is that I'm feeling too much relaxed. Third important thing, I had a very good relation thereafter 2 times with my wife. She was happy. But still, I feel that medicine should be continued. I said, yes, definitely you have to be. So I have continued with it, the caladium. I have increased little bit potency, 3 doses of caladium 200, and kept him on placebo and asked him to meet me after 15 days. When next 15 days medicine was given, caladium 200 was given. After 4, 5 days, he came immediately and he said, Doctor, there is again a problem. So what is the problem? The pus is coming from my urethra. I said, very good. He said, how can it be very good? This is the problem with which my problem was started. So I said it will happen for some time and it will disappear. The same remedy will cure that. If it has been not cured, I will let you know another remedy. But he was afraid. I said, don't keep relation for certain days. Let it appear first and tell me after 4 5 days. So he came again after 4 5 days. He said, yes, since yesterday it has been nearly about reduced a lot. So shall I keep the relation? I said no. For another 4 5 days, don't keep the relation. So actually, during his follow-up after 15 days when he returned, he was happy. The discharge was stopped. The erection was proper. He had a relation. His wife was happy, and everything ultimately settled the problem. So this is a wonderful remedy. Anupama, which rubric? First rubric was erections during half sleep, seizes when he gets awake. That is the single remedy caladium. And second rubric was erection, incomplete ejaculation of semen during soon to single remedy caladium. These were the two rubrics. Then erections incomplete gonorrhea after 3 marks remedy for caladium single remedy. Flaccidity of penis masturbation from again 3 marks single remedy. So this is a wonderful remedy one has to learn. Allen has given some glimpses of it, not well proved, but has in-depth action. Let us open the Allen's keynotes. It is American arum. It is from same family from where the arum triphyllum comes. Ericaceae. Araceae. Very sensitive noise. See, this is the first sentence of the remedy. Very sensitive to noise. Lightest noise startles from the sleep. Very sensitive to the noise. Asaram, Naxomica, Tarantula, Theridion, Borax, many remedies where such types of sensitivity is there, and this is one of them. Eructations frequent of very little wind as if stomach were full of dry food. So it is an indigestion, and this indigestion is generally because of long continued habit of tobacco. Impotence. See, this is very important symptom. Impotence with mental depression. Characteristic feature. Relaxed penis with sexual desire and excitement like lycopodium and selenium. Lycopodium, generally it is happened to be in aged people. There is lycopodium is also a good remedy for premature ejaculation. Selenium is having complete impotency over there. No erections even after caress, no emissions, no orgasm during an embrace. Like calcarea, selenium, these are two important remedies which are mentioned for the same. Pruritus vaginae induces onanism. Very important thing. There is severe pruritus of the vaginal area and associated with the sexual thoughts induces onanism. Origeron, income metallic. Pruritus vaginae during pregnancy with mucus discharge. So it is close to the creosote at this specific pruritus vulvi. Creosote is one important remedy. Falls asleep during evening fever and wakes when it stops. This is given in italics and it has a meaning. So whenever patient get a fever, he falls asleep, and whenever fever disappears, he wakes it again. Sweet sweat attracts the flies. Very, very, very important feature. There are many patients who talk, doctor, I don't know, but no other people gets bite of insect, but I used to get bitten by insects very commonly. This happens. Caladium is one important remedy which has that specific symptom. Mosquito and insect bites burn and itch intensely. Very, very important feature. Mosquito bites and ants or insects, whenever they bites, there is a tremendous itching, very severe itching. There is aversion to motion, dreads to move like bryonia. So motion aggravates, that is one important feature. Destroys the craving for tobacco. That's what happened in that patient, that caladium was given and tobacco habit was disappeared. It is a wonderful remedy. I used to use Naxomica generally, and after Naxomica, sometimes caladium is one of the important remedy. So this is wonderful remedy for tobacco habits, and one must use it. Tobacco use in any form like tobacco, bidi or cigarette is, yes, this remedy is useful for tobacco smoking, any form of tobacco. In our area, that mystery form is very popular. To stop that habit, caladium is a wonderful remedy other than Naxumic. I used to use first Naxumic and then caladium, because Nux relieves the stress which happens to be there. Generally, in cases of males, I used to use the mm, uh, Nux first. Second important thing, that here he has mentioned about the pruritus vaginae. Same pruritus is there in male genital system also. If you open the Boric also had, Boric said that there is a itching of prepuce or male genital system. That is very typical. It is also having strong action on the male genital system. So you have to be very much knowledgeable regarding all those things. Not only Allen's, you must read the Boric, you must read the Murphy. Murphy has given regarding all those things, and he said the same thing. He has given utilized this remedy many times for relieving the tobacco habits or smoking habits. This remedy action, just write it over there, it is 30 to 40 days action, very defecting. The symptoms are related with gonorrhea, suppressed gonorrhea, so psychotic miasm is dominant, very clear cut. Complementary is nitric acid. Remedy complementary to this caladium is nitric acid. Psychosyphilitic remedy, again, very defecting remedy. Inimical is arum triphyllum. Same, from the same family is the remedy which is inimical. Follows well, remedies which follows well are aconite, the cantharis, the causticum, the pulsatilla, the sepia, and the selenium. Many remedies are there which follows well. And last point, that is the antidote. It is antidoted by camphor, capsicum, carbovage, ignatia, hyoscyamus, and mercurius. So there are many antidotes. I will suggest just open the Borixma Trimedica if you have. Few highlighting points which I will discuss with you regarding the caladium. Tobacco hurt, very important word which is used. And there are many symptoms which happens to be there, at anxiety about the at the level of heart. There is palpitation, and all those complaints are there because of tobacco. Lobelia inflata is one more remedy for similar types of symptoms. Asthmatic complaints, then dreads from motion, that is very important feature. Open the male genitalia, and what is mentioned over there, the pruritus, the glands very red, organ seems larger, puffed, relaxed, cold sweating, skin of scrotum is thick, erections when asleep, seized when they fully awake, and there is an impotency. Relaxation of penis during excitement, no emission or no orgasm during an embrace. And this is the level where this remedy is wonderful, having wonderful action. Then in female, there is pruritus of vulva like ambra, creosote, and vagina during pregnancy. Voluptuousness. Voluptuousness means very much irritation and excitement. That is voluptuousness, and it happens because of itching. cramps, pains in the uterus at night. He has mentioned there is one thing one can do in order to stop that itching. Hydrogen peroxide 1:12 dilution you can use locally in order to stop that pruritus. It is a good one for that. Skin symptoms: sweat attracts the flies. Insect bites, burns, and itch intensely. Itching rash alternates with asthma. Burning sensation and erysipelatous inflammation. These are very important features. Respiratory: larynx seems constricted, breathing is impeded. Lateral asthma, mucus not readily raised, and patient is afraid to go to the sleep. So this is what is the caladium is there. Don't forget caladium specifically in tobacco heart, the asthmatic complaints, then basically male and female genital symptoms where pruritus is highly dominating. In males, it is a very important remedy for impotency, having their own characteristics over there, that during a sleep, half sleep, the erections happens to be there, but as soon as he awakes, it disappears, and there is complete flaccidity of the penis, specifically after the gonorrhea. And if it is because of gonorrhea, it indicates it is psychotic remedy, defecting remedy, 30 to 40 days action, and wonderful remedy in such types of symptoms. So that's all for today regarding the caladium. If any query is there, you can ask. Otherwise, we'll conclude. Tomorrow again, we're going to learn one short remedy, Calcare Ars, very important remedy. I have used
हॅलो
many
सर.
times Calcare Ars.
सर एक क्वेश्चन विचारायचं आहे.
Yes, yes.
सर एक पेशंट आहे ते पण टोबॅको च्युअर आहेत, म्हणजे आय थिंक 20-30 वर्षापासून असेल आय थिंक. तर त्यांचे कॉन्स्टिट्युशनल आहे नक्स. मी त्यांना नक्स भूमिका देऊन राहिली आहे, पण त्यांचं टोबॅकोचं ऍडिक्शन काही कमी झालं नाहीये. तर नक्स कॉन्स्टिट्युशनल तर आहे तेच त्यांची.
Constitutional
मग कॅलॅडियम
remedy. Which
करता येईल?
remedy?
सर
Which
नक्स भूमिका येत आहे. नक्स भूमिका
Naxvomica, madam, keep it in your mind.
पण
Nux is
ऍक्यूट
not
आहे.
an constitutional remedy.
हा. हो हो हो.
Nux is an acute remedy.
त्याच्या पण त्यांचं कॉन्स्टिट्युशन दुसऱ्या याच्याशी मॅच होत नाहीये. बघावं लागेल मला सल्फर वगैरे जसं, कारण नक्सभूमिका तर अक्यूट आहे.
That Nux will
पण ते
cover acute state definitely. If Nux is
अच्छा.
not completing it, you must complement it with the complementary, either a sulfur, sepia, or kalikap. There are
सल्फर.
3 complementary.
हा हा हा
हॅलो
हा सर.
Hmm.
हा पण ते सर
हॅलो सर.
ऍडिक्शन सोडायला तयार नाहीयेत, म्हणजे ते टोबॅको ऍडिक्शन जे आहे ना, कारण मेडिसिन मग वर्क करणार नाही ना.
You can think about the caladium if symptoms matches. There is one more remedy,
ओके
Staphylococcus aureus, which you can think of in such types of cases.
ओके सर.
Hmm.
ओके ओके. बट स्टॅफिस ऍग्रिया स्टेट मॅच. ठीक आहे, बघते सर. थँक्यू
Oh.
सर. थँक्यू.
हॅलो सर.
Huh?
Sir, how much is the dose, 30 or 200? Whether
30
it
is
is
better to
Naxomic or
start with.
Caladium?
30 is always better to start with, repeat it, and later on, if patient settles, go for 200, but 200 in frequent doses. When you go to the high potency, don't repeat too much.
Okay, sir. And 34, sir, repetition?
30 for 4, 5 days, 7 days, you can give.
Sir, thank you, sir.
So that's all for today. Good night. We'll meet tomorrow. Yes, sir.
सर असं ऐकलं होतं की जेव्हा सिनियर होमपॅथकडनं की जेव्हा आपण टोबॅको च्युअरला कॉन्स्टिट्युशनल मेडिसिन देतो, बाकीचे देतो, जेव्हा इफेक्टिव्ह आपला रिझल्ट मिळत नसला त्या पिरियडला टॅबॅकम देऊन तुम्ही ती केस सॉल्व आउट करू शकता.
ते आयसोपॅथी होते.
तसं टॅबॅकम आपण
That becomes an
Isopathy.
isopathy. Tabacum, if the symptoms matches, tabacum मध्ये सी सिकनेस आहे, टॅबॅकम मध्ये हार्ट कंडिशन्स आहेत, हार्ट प्रॉब्लेम्स आहेत, कॉन्स्ट्रिक्शन ऑफ चेस्ट आहे असतात. इफ इट मॅचेस, येस, टॅबॅकम इज द रेमेडी. बट टॅबॅकम just to prevent or to stop the tobacco habit, it is not the remedy. So my suggestion is always that tobacco should be used as a remedy, similar as a simillimum to the patient. So if it matches, definitely tobacco will work. But just giving tobacco will not stop the habit of tobacco.
नाही सर, त्यांचं असं म्हणणं होतं की हॅबिटसाठी नव्हे, पण जेव्हा आपण रेग्युलर त्यांना बाकी त्रास असेल काही, पण जेव्हा आपले कॉन्स्टिट्यूशन आपण देतोय, सपोज रुमॅटिझम असेल, ऍसिड पेप्टिडोसवर किंवा डायबिटीससाठी, थायरॉइडसाठी, एन नंबर ऑफ डिसीजसाठी, पण जेव्हा एक्सपेक्ट आपल्याला रिझल्ट मिळत नाहीये किंवा कॉन्स्टिट्यूशनल खाली कार्ब आहे, तर त्या टायमाला तुम्ही टॅबॅकम देऊन त्याचं प्रूव्हिंग करून बघा, असं त्यांचा म्हणजे सिनियर होमोपॅथी त्यांचा सेल्फ एक्सपिरियन्स त्यांनी सांगितलं होता.
But it might be, I don't know, but I have not used like that. Tabacum I have
Right.
used only in cases of similimum, and it works definitely whenever used in similimum.
ओके सर, थँक्यू.
So good night, and we'll meet tomorrow.